Welcome, everyone, to Day 2 of the NCDA Virtual Conference. I'm so pleased to introduce our second keynote speaker, Dr. Patricia Arredondo. Dr. Arredondo is a scholar practitioner and academic entrepreneur with more than 35 years in higher education and organizational consulting spaces. She is president of the Arredondo Advisory Group, faculty fellow with the Fielding Graduate University, and faculty and coach for the New Leadership Academy at the University of Michigan. An academic administrator for 17 years, Dr. Arredondo served as president of the Chicago School of Professional Psychology, Chicago campus, associate vice chancellor for the academic affairs and dean of the School of Continuing Education at the University of Wisconsin in Milwaukee, and senior vice president for student initiatives at Arizona State University. She was co-PI on a 4-year grant from the National Science Foundation for Academic Leadership Development for STEM faculty women at historically Black colleges and universities and tribal colleges. She is a regular presenter at the annual STEM Women of Color Conclave. She served as the first Latina president of the American Counseling Association. Dr. Arredondo is the author of more than 100 publications and bilingual counseling training videos and 7 books that reflect her research interest in diversity-driven organizational initiatives. Latinx mental health, women's leadership, and the application of multicultural guidelines for professional development. Her recent book is Latinx Immigrants, Transcending Acculturation and Xenophobia, published in 2018, and in preparation is a book on unhealthy work environments for STEM women in higher education. Welcome, Dr. Patricia Arredondo.
Thank you, Kathy. I'm so delighted to be here, Dr. Evans, and to be part of Day 2 of the NCDA virtual conference. I'm so excited about presenting with Dr. Evans because the theme of her conference focuses on social justice. And this is a topic that's near and dear to my heart as counseling professionals, on how we advance a multicultural as well as a social justice mindset into career counseling and coaching, but into all of our endeavors as professionals. I would say that as a way of beginning, and Dr. Evans, thank you so much for that introduction. I feel very humbled because as much as I've been in the field for 35 to 40 years, I continue to learn about the need to do the kind of work that focuses on social justice. When I gave the title for my presentation about 5 or 6 months ago, the COVID-19 pandemic was not with us. The racial injustice movement that is flourishing right now was not with us. So this is a real time of movement, a new time of advocacy. And I'm just, again, feel like the opportunity to be with everyone today is very moving. So I want to move to my next slide and hope I can do this on my own. No, I don't think I'm doing it the right way. Let's see if I can, there we go. Thank you. I'm looking at the reason why I feel like there's an urgency now. Now, someone like myself who's been in the profession for 40 years has lived through a number of moments going back to 1978 where there were upheavals in our society, not only on a domestic level, but on a global level. But the convergence of these two pandemics of racism and white supremacy and COVID-19 are ones that are not going to be easy to move away from in the short term. They're ones that I believe are going to continue to challenge all of us as professionals to do our work to to actually be much more intentional about learning about the effects of these two pandemics on the clients we work with, on the students we teach, on the departments we chair, and in society, in the communities where we live, and the kind of work that we have to do. So our mindset is going to have to actually broaden further. Okay, let's see. Moving down to the next slide. For some reason, I'm not able to move it on my own. Let's see. Thank you. These are the headlines that I read regularly, and since the pandemic started in early March, I was in California when the mayor of Los Angeles, I was in Costa Mesa, talked about a quarantine that was going to start to go into effect in Los Angeles. And subsequently, here we are 4 months later, almost 5 months later, we still are living through the pandemic. So the headlines that I pay attention to are ones that, of course, affect people that we know, people that perhaps we're working with. And so the pandemic about working moms are struggling. And yes, working moms are still, in many cases, still doing their work through a telecommuting process, but they're also being the homemakers. They're also homeschooling their children. So it's impossible to ignore this and the stress on women, the stress on mothers. We know that there's a great inequality that's affecting people based on racial and ethnic backgrounds. And that economic hardship is, of course, affecting families. Can I pay the rent? Will I be eligible for unemployment, and for how long? So all of this inequity is something to be mindful of. And as we know, workers are being pushed to the brink because they have delayed unemployment payments. And there's new lines that we see images of those new lines in the newspaper every day. And of course, the convergence of the murders of George Floyd, Breonna Taylor, and other Black men in the United States in the last few months has really heightened our awareness that being Black in the U.S. is a danger, that it's not a safe place for people who were born here, who live here, who are trying to thrive here. So as counseling professionals, as career professionals, this is context that we cannot ignore. And I know sometimes I think, okay, I'm getting oversaturated, but on the other hand, I have to keep my mind and my ears open because I learn more every day when I read the stories that accompany these headlines. So in the next slide, I will be talking about the context of social justice. It's not new in the counseling profession. Social justice has been with us for many years. It gave birth to our focus on the multicultural counseling competencies. Sometimes people have asked me, Patricia, what came first? Well, the multicultural counseling competency evolved because of our awareness about social justice and equities. And as we look at the definitions here, it's a mindset of awareness of inequities, xenophobia, oppression, and disenfranchisement of many groups in the United States. We also know that the social justice mindset is recognizing systems in which we all live, systems that affect individuals, communities, and society at large. I think many of us have studied the Bronfenbrenner model of systems, and we know that there are macro systems, mesosystems, ecosystems, and microsystems that affect individuals, community, and society. So if we're working from a social justice mindset, we cannot focus only on the individual. We have to understand, for example, how racism and systemic racism affects people in their career-seeking opportunities as they look for promotions, and how they advance or don't advance. So we have to look at the societal context. Of course, social justice is an ethical mandate. And if we look at the ACA Code of Ethics on personal responsibility, it states that counselors are expected to advocate to promote change at individual, group, institutional, and societal levels that improve the quality of life for individuals and groups, so that we are all, as members of the counseling profession, held to this ethical responsibility. So as we move into looking at the groups that are affected by the two pandemics, we also want to keep in mind the slide on multicultural counseling competencies that comes next. And this is not new. And the competencies were first published in 1992, and in many ways are still anchors for how counselor training takes place, and counseling practice and research and organizational development can occur. What we know is that as individuals, we are all cultural beings. In my role as a coach with women and men professionals, I have to be aware of my own cultural values and biases about how I've come into the profession and how that influences the kind of coaching I do with individuals from different backgrounds. And as they look at their career trajectory, which is also part of the second domain of awareness of others' worldview. You know, we all have different plans in mind of how we want to unfold our careers. And I have my own ideas based on perhaps how I've approached my career development, but it's not been perfect. And I have to, in the process of working with others from different gender backgrounds, disability backgrounds, understand the assets of the individual, look at them from a strengths basis, but also know that there are barriers that may be facing other individuals as they pursue their career goals and want to enact their career identities. So the multicultural counseling competencies continue to be anchors for all of us as professionals to get to know ourselves further, to understand where our judgments come in and how those judgments can become part of what gets in the way when we are working with clients from diverse backgrounds, particularly now in 2020, and therefore how we engage in what we call culturally competent behaviors. So we have the tools in the profession to guide our work as career counselors, career professionals, and coaches. The next slide, please. As we live through the pandemics, the priorities for career counselors and coaches, I think, become shaped even further. We have to appreciate as counselors the landscape of change and the stressors that are affecting individuals and groups affected by both pandemics. There's a lot of uncertainty. There is a lot that's out of our control right now. And as much as we'd like to plan ahead, as one great example, the NCDA conference has been in the planning for a long time to have been held in Minneapolis at the end of June. That decision became a different kind of decision to change to a virtual conference. So all of us in our lives are facing these uncontrollable factors. So as much as we believe in self-determination and self-efficacy, these are other variables right now that are causing us to do different kinds of problem solving, to plan differently. And so our awareness and knowledge building in different contexts, I think, is also perhaps one of the takeaways from this pandemic, is that we are all paying attention to other situations, to other circumstances. So every meeting I have every day is a Zoom meeting. This is a new way of our working. And we're also doing, having difficult conversations through Zoom. So our ambivalences about talking about racial injustices and looking at Black Lives Matter and talking about that together, some people have said to me, this would be much better if we could do it face-to-face. Well, ideally, yes. Alternatively, we're using the spaces we have and the voices we have to move away from ambivalence and talk about the realities of our racial inequities in the United States and the perpetuation of white awareness and white supremacy, and how do we get into more of a racial awareness and understanding of systemic racism. So when I coach, for example, I talk to all the clients I coach about the conditions that they're going through right now at their respective universities. All the clients I coach are women and men in universities that are fraught with not only the effects of the both pandemics, but how to plan for the next semester coming and what it's like for them, primarily as individuals of color, African American men and women, and Latinx women and men, how they're managing in these circumstances, because often when there are crises, there are crises occurring in your workspaces, there can be more heightened anxiety, more heightened anger, more heightened frustration, and it can be turned against one another. So attending to that as I coach has become primary. Moving on to the next slide, I just want to spend a few minutes talking about who are the most affected by COVID-19. And what we can see that the most affected are people who we can't really slot into a box. We're all individuals with multiple identities. So we can say there are people of Asian heritage, but they're also healthcare professionals. They're also family members. And what we know is that a vast majority of the healthcare professionals in the United States are of Asian heritage. So the doctors, the nurses, people doing the x-rays and so forth, many are of Asian heritage, and yet they have been the brunt of a lot of disparaging comments. In California right now, the AAPI organization has asked the governor to set up a special task force because the hate crimes against people of Asian heritage have just skyrocketed in California, which is the home to many Asian persons. We know that African Americans in all professions and work roles continue to be assailed, not only from the health perspective, that there is a great disparity in the effects of COVID-19 on the African American community, but African American professionals are also being assailed unnecessarily. If you've seen the story about the gentleman in New York, Central Park, who was bird watching, and then a white woman called the police on him because she felt that he was threatening her because he told her dog to, or take her dog who was unleashed, to take her out of the bird watching area. You know, these kinds of senseless assaults put a lot of stress on African American people because you don't know where it's going to come from. I read earlier today about an African American woman working in New York, and she had a complaint about the water in someone's hotel room, and the couple went down to complain and then assaulted her. Fortunately, it was all caught on video, and they have arrested the couple from Connecticut, but this is simple hatred, and this kind of violence, interpersonal violence, is something that is not making anyone safe. But I think as counselors, we need to be our awareness heightened about how it is more threatening to people of color. DACA recipients have gotten a reprieve from the Supreme Court, but their family members are also highly affected by COVID-19. And I talked a little bit about the disproportionate of work falling on women, mothers, because of COVID-19. And I'll talk a little bit more about all of these populations as we get through the next slides. The dimensions of personal identity is a model that I developed back in 1992. And I think it's especially salient, continues to be salient to all of us in our work as counselors. It speaks to us in terms of our dimensions of personal identity, but also about the individuals who we're working with, people who we are not working with, but are on that list of most affected. What we know through the dimensions of personal identity, if we look at the C dimension, is that we're living through a historical moment of these two pandemics. But we're also living through in a social political climate that has made a lot of the health issues and economic issues political matters. And that's something that we cannot ignore, that as we all try to get healthy, there is a politicization, I'm not saying it right, but there's the ideas of not wearing face masks, about social distancing is considered to be my right as a person in the United States, and yes, and it's being politicized, but yet there's a lot of people still getting sick. My home, where I live now, my home in Arizona, is a place where the rise in the infections and the deaths is astronomical, considering where it was on April 30th, when the opportunity to release or relieve some of the stay at home and do your work from home. So I think the social political climate is something we as counselors have to be aware of. And I remember when I was a counselor in training, there were certain things you didn't talk about. You didn't talk about religion, and you didn't talk about politics. Well, you know, it's hard to not feel like the effects of politicization of our epidemics is something that people are living with. And if we look at the A and B dimensions, is that some people are more affected by this social political climate than others. And we look at the intersecting identities, people who are poor, people in nursing homes, people with disabilities who do not have the same kinds of options to return to work, or don't have the resources at home to do the telecommuting that some of us have at ease to do. We have to look at how these A and B dimensions of people's lives are affecting the economic hardship, how they're affecting their options for going back to work. Our college students who are recent graduates are able to or not able to launch their career, how high school students are now being compromised about starting school. And many, if we look in the ethnic minority community, the Latinx population, we have the highest percentage of first-generation college students. In 2018, 48% of Latinx students were first-generation college-going students. A lot of those students are not going to be able to go to start college. So there are so many conditions in the A and B dimensions, so we can't simply say it's a person who's a Latina female. It's a Latina female perhaps who has responsibilities also for working and supporting the family that she lives with while she starts school at a community college. So we have a lot of career wishes, career goals that are in some ways going to be on hold or compromised based on someone's A, B, and C dimensions. If we can go to the next slide. to talk about some of the ways the pandemic and the two pandemics are affecting healthcare workers. I talked a little bit earlier about the representation of Asian American Pacific Islanders in the healthcare professions, but we also know that hospital staff in certain parts of the country are being furloughed, not everywhere, but that their health and well-being is being threatened by being frontline workers and serving people where the epidemic has increased in Arizona, in Houston, and in Florida. So we have to be, again, cognizant and knowledgeable about how those individuals doing their job are under threat. Lack of equipment. Healthcare workers also have contracted COVID-19 and must return to work in many cases to keep their job. And as I said earlier, there are new professionals facing difficulty finding work due to hiring freezes in the healthcare profession. And finally, and we've seen this not only healthcare workers, but teachers are also thinking about early retirement due to an increase in burnout. I've seen a lot of postings from people in universities and teachers that say, I don't know if I want to go back to teaching live because I'm of an age that I'm more at risk of perhaps contracting the virus. So this is a population that cares for us, but on the other hand, we're also seeing the threats to their well-being. To the next slide, challenges for DACA students. I think most of you know that the DACA students are the deferred action arrivals. They were childhood arrivals. DACA refers to childhood arrivals who came with their parents when they were 1-year-old, 2-year-olds to the United States, and they came in undocumented status. Well, the Supreme Court ruled that they may continue to remain in the country, but they cannot receive federal relief funding. Some states have given relief to these students to go back to school, but they still have no clarity about whether they can continue to remain and for how long. And their DACA status, as we can see, can be canceled at any time, or their parents may be deported during this COVID-19 pandemic. I read earlier today that people are saying, okay, we support the DACA students staying here, but we don't want them to get any federal funding because that's taking it away from U.S. citizens, even though the parents of many DACA students have historically done the work that many Americans will not do in the service industry, in the agricultural fields, and so forth. So the economics is really weighing on these students. Let's go to the next slide, please. I've talked at the beginning about the injustices that are affecting African Americans, continuing to affect. This is not new. We have 400 years in this country of living through social injustices towards African Americans. We may not be in living slavery right now, but the effects of racism continue in this country, and how that affects the economic well-being of African Americans in work. In the COVID situation, according to the CDC, approximately 5 times more of non-Hispanic Black persons, so these are African Americans, have a rate approximately 5 times that of non-Hispanic white persons of being COVID victims. I read a statistic this morning that many people who are African American can tell you they know someone who's died as a result of COVID. So it's kind of been a plague in the African American communities. And what we know that many African Americans have essential worker roles. They're professionals. There's a professional ranking, and there's essential worker roles that are often held by African Americans. and they use public transportation to go to those essential work situations. And in 2019, 64% of entry-level positions went to white persons, and I can see, and also into the executive ranks. 85% people in executive ranks were white. So we look at, perhaps goals that have been compromised. Working 3 part-time jobs. You're correct. 3 times working 2 jobs. This is amazing stressor on individuals' health, their physical health and their mental health as well, living through this current pandemic. So African Americans, and we see it through Black Lives Matter that started in 2015, 2016. And, I guess I'm encouraged to see that universities, but also the private sector, has stepped up their responsibility to do more in this era of racial reckoning that we're all living through. Next slide, please. Women. Well, not only do we still live with the economic disparity about being paid 78 cents to the dollar, I don't know if that's still going on, that shows gender equality being very slow progress for women in the United States. But during this period, there was another piece I read about they've been given more priority to men than to women during this period, because men are still seen in this kind of sexist systems we live in as being more affected from an economic standpoint. And we do know that women, as I said earlier, are still highly responsible for the home care of children, the school, homeschooling, and so forth. Another article I came across fairly recently, this was in June, I read this article that men in universities are submitting for publication rate at higher rates than women. Well, no surprise, they have more time to still publish, to write, but women who are academics are going home and are staying at home and compromised in their own research endeavors because they have the child care to take care of and the homemaking to take care of. So very interesting statistics here. Next slide, please. A little bit more on Latinx workers and students. We remember that the Latinx population in the United States is about 60 million right now, and so about 18% of the overall U.S. population. And it's not going to increase because immigration has actually gone down. But what we're seeing is that more Latinx heritage persons are born in the United States. So I'm 2nd generation and 3rd generation Mexican American woman. My children are all 4th generation. So, we have people of Latinx heritage who are not immigrants, and they're the individuals still whose parents have a high rate, 4 times that of the non-Hispanic white persons with COVID-19. Why is that? Well, they're also frontline workers. They're delivering the food for restaurants. They're still working in hospitals, as are African Americans, doing the service work in those hospitals. They're bus drivers, as are the African American population. So they're coming in contact with a lot of people who are potentially exposed already to the virus. And then what's also the stressor are job loss, income reduction, loss of insurance benefits, and many are not eligible to receive federal aid, and that may be because of their undocumented status, but there are still people who have been contributing to the economic well-being of the country. So we talk about them being in the service industry as grocery clerks, agricultural workers, and especially with agricultural workers, it continues to make me very sad that we mistreat agricultural workers. We wouldn't have people picking the fruit and the vegetables and doing that kind of labor. If we didn't have people from Central America and Mexico doing the work, because they're the ones who continue to be the agricultural workers in the United States and yet are not working with the kind of protective equipment to do their jobs. And I think for the Latinx students, as I mentioned before, the idea that many of them are ready to go to college, and if their parents are also doing 2 or 3 jobs, you know, how they learn at home during school closures becomes a setback for the population that is increasingly becoming involved in United States workforce. The next. What I think this whole situation is creating for us is a loss of work identity. And as I said earlier, we're not doing our work as we once imagined we were doing it, would be doing it, or continue to do it. So there's a lot of loss that's, I think, affecting all of us here in the United States, all of us here on the call when it comes to our professional identities. And that the changes in the work environment may be continuing. Those of you who are professors, faculty, administrators, many of you are already anticipating that online teaching will be the mode for the fall. And looking at how that affects your own personal space and how you continue to work from home. Our career identities have also been affected because of furloughs, layoffs, loss of insurance coverage and payouts. You know, I think of one of my son-in-laws who's been furloughed, and he's been furloughed for the last 3 months, and wanting to so much get back to his business of selling musical equipment, but, you know, he's a musician by training, and yet, you know, he's doing his work at home, albeit he's in this furlough status. People want to continue to work. Our identities as professionals, whether we're in the healthcare profession, we're in higher education, we're in sales and marketing. Working from home has been a great adaptation and adjustment. People who have small businesses have really taken a hit. If you're self-employed and have lost your business, there aren't a lot of remedies. I know that the federal government has put in place the CARE Act and other programs for small business owners, but it's not enough. And again, we've also read about the abuses of who qualifies for a small business loan and who's taken advantage of it. And it's often not the people who are truly doing small businesses. The people running hairdressing salons or barbershops or small stores, they're the ones that have lost their businesses. And then loss of opportunities all across the board. You know, career plans, I guess you could say, thwarted, and what that means for the future and how we as counselors and coaches intervene so that we give hope, we share optimism with individuals, clients we see. Could we move forward, please? Because I want to make sure I cover 3 more slides before we get to the questions. What is essential here? I think the mission of the National Career Development Association is one that we have to keep in mind, that we are about empowering individuals to achieve career and life goals, but we're also empowering individuals about how to feel optimistic when your career goals are undermined or thwarted or not, again, within your control. And as career counselors, we also have to become comfortable about working with clients of color healthcare workers and the emotions that we're feeling, because we have a lot of data and we may be working with people who have a family member who's passed. We need to know more about our own racial identity development. How did we learn about racism? What are the messages that we haven't shaken off yet about racism? And the whole meritocracy system that everyone can pull themselves up by their bootstraps and get to where they need to be. Well, that is not, it's not a level playing field, everyone. We know that. So we have to be able to have conversations about race, color, and about what our work with transgender clients through this as well. Clients who are living with disabilities. And we also know that there are prejudices in the workplace. How do we tackle those? How do we use our privilege to tackle those privileges, those prejudices in the workplace, particularly if we have some roles of authority? How do we confront people who say Black Lives Matter isn't important or who otherwise dismiss what's going on? Can we go to the next slide, please? So we need to consistently and more frequently address institutional racism and interpersonal biases. And all of these facts come from our 1996 document, Operationalizing the Multicultural Counseling Competencies. So I would encourage you to review that 1996 document that has 119 action statements about what we need to do from an action standpoint, not just from an awareness standpoint, but move towards action as we engage in helping our clients do career planning and career decision-making in these difficult times. Next slide. The multicultural counseling competencies have also embraced the social justice competencies through this new model that was published in 2015. And what's very important is that this is a systemic model that introduces the various systems in which we need to address social justice inequities at the client level, at the community level, at the organizational level, at the societal level. And we know that as counselors, we have typically more privilege because we have credentials to do our work, but we may also be counselors who are not seen as privileged because of some kind of ism that is attributed to us, whether it's racism, sexism, homophobia, and so forth. So the whole idea about working with careers from a career counseling and coaching standpoint is very systemic. As I said that at the beginning, it's not just an individual. We're looking at an individual in context. Okay, moving on, please, to the next slide. I'm going to close my presentation with the inspiration from two individuals who I consider to be social justice advocates. The first is Dolores Huerta, who was very active, continues to be very active in civil rights movements in the United States. Dolores is 90 years old, and she was very active in the farm workers movement in the late 60s. To Dolores Huerta is attributed the chant, "Si se puede," that Barack Obama used in his presidential campaign, and he did give her the Presidential Medal of Honor. But I love Dolores Huerta's statement here, and this speaks to all of us. I think that every moment is an organizing moment. Every person on this call today, on this agenda with NCDA, every person is a potential activist, and every minute is a chance to change the world. I think we are all activists. There's an activist button in all of us, and we have to be able to step forth with our social justice leadership because it means caring about others' well-being. and being truthful and trustworthy to all the clients that we're working with in these difficult times, and accepting our vulnerability and that of others. We want to do the best we can on behalf of our clients, and we also have to engage in self-care as we do this activism and this facilitation on behalf of others. So can we move to the next slide, please? We're leaving you also with another slide that talks about the 2015 competencies and levels of advocacy work. So if we're all advocates and activists, there are different places where we can intervene. And in the 2015 competencies bring to us all of the different levels of intervention at institutional level, for example, where we work, and looking at inequities in regard to schools, churches, and community organizations that are not being inclusive and providing equitable opportunities for everyone. And so could we go to my last, I think it's almost my last slide. This is one of my favorite quotes, and this is from the great Toni Morrison, who left us in, I think, January of this year. And Toni Morrison, brilliant writer, poet, and was professor emeritus at Princeton, from Princeton. And her reminder, her call to action to us is, when you get these jobs you have been so brilliantly trained for, just remember that your real job is that if you are free, you need to free somebody else. If you have some power, then your job is to empower somebody else. I believe the counseling profession is about empowerment, and it's eloquently stated in the NCDA mission statement that we all have an opportunity and a responsibility, because we are free, to free others and to empower others to be who they can be. I'm going to close with that, but I want to just point out a couple of other handouts. We have our sources, our resources, and then I think there is also a slide that talks about me. Yeah, you have me there, that Dr. Evans already spoke about me to you. If you could go back to the slide with Toni Morrison's quote, because it's really the thought I want to leave with everyone, that if we have some power, then our job is to empower somebody else. So thank you for being part of this presentation. Again, it's been my honor to speak with you and share with you some of what I've learned along the way and some of what I continue to be very passionate about in my work as a counseling professional. Thank you. And I think there's questions and answers. Thank you.
Yes, if you guys have any questions, you can go ahead and type those right now in the chat section. Make sure you are selecting to send those to all participants. And I'll read those out for Dr. Arredondo.
Thank you. But I like what I'm reading in the chat, that everyone loves Toni Morrison's quote, because it speaks to all of us at this moment. It's a quote of hope as well. You know, it reminds us that we are here to serve, but also to empower. Yes, I have seen challenges faced by African American immigrants and the population that we call Afro-Latinx. The African immigrants are oftentimes even seen as a threat by people who were born in the United States who are African Americans. And it's part of that, I think, how in the United States we've been conditioned to xenophobia, that we see the other and disparage the other because they're perhaps taking the space of those of us who feel like we've disenfranchised. But the African immigrants, or immigrants from the Caribbean, for example, who speak, whose language, first language is in English, I think are also seen as I guess, infringing on the rights of U.S. citizens. But yeah, they're also, I think, part of this population, again, depending on if they're college students, you know, with the recent threat of sending people back to their country who were international students, that, you know, African immigrants being part of that, or African students being part of that. But I think for many years, I've worked with African immigrants in the Boston area back in the 70s, and I saw the, I guess, the unhealthy environments they also were raised in. And yes, I am from Lorain, Ohio, where Toni Morrison was born. So that's one of my little claims to fame as well, that I share in her birthplace of Lorain, Ohio. Are there other comments that people want to make or questions to ask?
There's a question from Jordan Rossi. Any suggestions about how this significant topic can be adapted to career counseling groups?
This topic is very adaptable to career counseling. You mean groups that you're working with or teaching, I guess, is one of the questions I have. Certainly, this is very adaptable to if you're a faculty member or an instructor to teaching. But in process groups, well, I believe that if you start with the dimensions of personal identity, Jordan, and have everyone look at who they are and their intersecting identities, and how that relates to how they got to where they are as career professionals in training. You know, what were the, I guess, the assets they had to move into their careers, and what were some of the, you know, barriers they faced. So having that be part of a process conversation in a career group, you'll find how people arrive where they are from different starting points, even though they may all be now counseling students in a career class, but they all got there differently if you use the dimensions of personal identity and looking at the social historical context that got them there. So you use peer-to-peer conversations as well. Again, it's not that I'm promoting the dimensions of personal identity, but I am. You know, it's a matter of how we open conversations to look at who we are as individuals, but individuals in a larger society, a larger system that impinges on all of us. That's one thought I have about how to use it. And also social justice is an important conversation to help people think about, what does social justice mean to me? People think it's like a feel good, or that you have to get into a march to do social justice work, but there are many ways to engage in social justice advocacy. So Desmond says he's worked with 2 of my siblings. That's interesting, Desmond. So in Ohio, the Latinx on the panel for, I'm sorry, I didn't read that particular statement. It went by too quickly. Something about Latinx individuals. You know, as a multicultural social justice advocate all my life, I really believe in the work of coming together to do this work. Yes, there are special efforts I will do with the Latinx community within AMCD or within ACA or the women's groups, but we're all, you know, my intersecting identity is something that is core to me, and my focus on culture and how culture matters, how we're all cultural beings, that we've all been socialized in the culture of counseling, but that doesn't always fit for everyone because we've been socialized in theories that are not applicable to everyone. So we have to always unpack those theories. the textbooks that we're reading, and looking at how it speaks to all of us. Yes, occupational wellness has a place in social justice, absolutely. Thank you.